Now, what if the edges of the uterus, they are bleeding? Here is where you will have box sutures, the importance of box sutures. So they're basically non-cosmetic, absolutely. So when you're taking box sutures, the endometrium, forget about it because it gets everted. The edges become something like this, this. Because you've taken a box suture. When I'll explain it to you, you'll be able to understand it better. But usually box sutures, the entire length through you don't take. You take at a place where it is bleeding too much. It's difficult to control even with the help of locking sutures. So how to go for taking a box suture? Now these are the two edges of the endometrium. Basically you will require in those cases in which the patient was not in labor, so she has a thick lower segment, or the patient was preterm, for whatever reasons you had to operate upon a preterm patient. So obviously the lower segment will not be made in that case also. So maybe at 34 or 35 weeks or even at 36 weeks. So how will you go for doing a box suture? What you do is basically you take the suture, you take the full length, the full thickness like this. Here is the needle. Again, now you're going from this side to this side, taking out the needle through this side. Can you see? Can you appreciate it? And now you're going back. See, the movement is like this. I'm going back. I first threaded it this side and now I'm going back from this side to that side. So it's very simple, but very, very excellent suture in that case because it's very good for hemostasis. Excellent for hemostasis. Yes. So now I've taken the needle out and I'll tie it, see, properly I'll tie it over here. So this entire portion which gets inside it, over here, whatever the feeding artery was, this gets nubbed. Even if the feeding artery was here, there'll be a knot which will be coming here. So even that gets crushed, that gets inside the suture, and as a result of which it stops bleeding. It's beautiful, it's very nice, but obviously through the entire length you can't take. And now in the next segment I'll explain to you what if through a burrowing suture you had to take through the entire length because the entire segment was bleeding too much. You have taken box sutures. The other box suture, suppose you've already tied it over here, the next box suture will be from here to here, isn't it? See, if you want to go now, it will be from this side to this side and then back from this side to this side. So that's the whole length. If suppose you had to go, in that case, the endometrium will be something like this, It will be straight, but the entire endometrium will be peeping through. So in that case, what will help will be the burrowing sutures, and I'll explain to you in the next segment.